Chiyenreugo is a clinical psychologist at Neem Foundation. She is responsible for the overall management and coordination of programs at the organization's Abuja-based psychology center called The Sanctuary. As a trained psychologist, Chiyenreugo specializes in trauma support, substance and alcohol abuse, mood disorders, psychosis, and other related mental health challenges. A keen advocate of mental health, she has worked in rehabilitation clinics within and outside Nigeria. She has authored articles on mental health and appeared on public broadcast radio and television programs in Abuja, focused on raising awareness on psychological wellness. Chiyenreugo currently co-hosts a 30-minute weekly mental health radio program on Rhythm 94.7 FM Abuja called the Mind Clinic. And I want to believe that she's going to tell us when this program holds, so that those who can log in would log in. I'll ask Chinyere to please hold on while I just check if there are any questions in the chat that I have missed. Oh, awesome. So no questions yet. So I'll invite Chinyere to please. Thank you, Chinyere. Welcome. Please go ahead.
Thank you. I'd like to stand on existing protocol. Please permit me to just share my slide. Oh, great. It's really an honor to be here speaking to you today. I'd like to thank the foundation for making this possible. So I will be speaking on, first of all, my name is Chiyenreugo Onyekwere. I'm a clinical psychologist with Neem Foundation, as introduced earlier. And today I'll be speaking on healing from emotional trauma. Just a little bit about Neem Foundation, who we are, so that you can get to know us. We are an NGO owned by Nigerians and run by Nigerians. We offer mental health supports amongst other capacities that we bring into, but we focus a little bit more mainly on conflict areas. So the bulk of our work would be in the Northeast, and we enter in the Northwest, as well as other African countries and non-African countries that we also offer psychosocial support. Here in Abuja, we do have a mental health clinic called the Sanctuary, and this is where I function in the capacity of managing the center, and I'm offering psychological support to clientele who work in virtually or in person. I know we talked about the radio program and I did not give full information. The Mind Clinic is a weekly radio program that we run with Rhythm FM, and it's every Wednesday at 8:15. We talk about different topics, and we bring in different experts, and we have a 30-minute conversation. So feel free to join in and be a part of the conversation. All right, let's get going. So a little bit of an introduction. All right, bad experiences or deep pains of an unforgettable moment that lingers can sometimes affect us in what feels like an irreversible way. It can leave us overwhelmed, in pain, and feeling unsafe. We can't change our negative experiences. We can't change our past experiences, but we can heal from them and we can live a healthier life. So let's look at emotional trauma. How do we heal from emotional trauma? But first of all, let's understand what we're talking about. What is trauma? Trauma, in the simplest of terms, is a wound. It's a deeply distressing or disturbing experience. A psychological trauma would be a response to an event that we find highly distressing, to the point where it overwhelms our ability to cope, it overwhelms our capacity to cope. Psychological traumas can leave you struggling with upsetting emotions and memories and upsetting thoughts. It can make you very anxious. It can leave you in a highly anxious state. It can also leave you feeling numb, and you get to a point where you just shut everything out, shut everybody out, and you can't really have any feelings towards anything. You can be disconnected from society, you can be disconnected from people, and you can also feel disconnected within. And also you find yourself unable to trust people. You find yourself unable to rely on anybody for anything as a result of a break in your worldview. One of the things I find very interesting about trauma is that what it also does to people is that it changes your understanding of the world. And if you've grown up in a place feeling like you've always, people are there for you, people are able to support you, and you feel like those that you have trusted have caused you some form of trauma, and you can find that there's a big change in the way you see life. There's a big change in your understanding of your control over yourself and the things that happen to you. Because largely speaking, we tend to have some level of control. But when people are traumatized or they've gone through an experience, one of the key things you find is that they begin to lose control. So they do everything and anything sometimes to ensure that they do not re-experience that upsetting or negatively disturbing experience. So let's look at some of the things that can cause trauma. It's not limited to what I've listed here. There's so many things that can cause trauma. The experience of trauma is very subjective. At any point, anything can be traumatic for anybody. There's a lot of personal influences, like your personality, your support group. If you are able to receive support immediately the event happened, that can also be a protective factor for somebody who may have experienced a traumatic event. However, here are some causes of trauma, emotional trauma, psychological trauma that we could go through. Unexpected attacks, like an accident, injury, a violent attack, sexual and gender-based violence. I put this cap here as sexual and gender-based violence because a lot comes under it. We can look at physical abuse, verbal, psychological abuse, domestic violence. We can even look at rape, and we could look at so many things under this bracket, under this umbrella, as sexual violence and domestic violence. And we know that usually when they say the history of sexual and gender-based violence, women tend to be more on the receiving end of this form of violence. All right, so other causes that we can look at continuous threats to life. For example, when you're battling like a life-threatening disease, or you have some form of injury that could be life-threatening. Another thing could be natural disaster. We work a lot in the conflict areas, so we understand how much of an impact this tends to have on people. Giving birth and surgery, we've heard stories of postpartum depression, we've heard stories of trauma as a result of giving birth or going through surgery, not just physical trauma, also the emotional trauma people tend to experience sometimes when they go through the hospital or when they go through like a major surgery. Sudden death of a loved one. These are one of the things that can also lead to a traumatic experience. Sudden death of a lost job. It doesn't always have to be somebody. Sometimes it's something that we find and something that is very important to us, or we hold that holds a lot of value and meaning to us. When we lose that, that could be traumatic for us. Sudden deaths of relationship and severed relationship that a person has so much emotional deep investment into. When you lose those relationships, for a lot of us, that can actually be quite a traumatic experience. All right. So let's look at some of the symptoms. I've grouped the symptoms into psychological and physical. And I want us to look a little bit at the physical symptoms of psychological stress, of trauma, of psychological trauma. Shock, denial, disbelief. You will see that quite often, shock, denial, and disbelief. Confusion, difficulty concentrating, anger, irritability, mood swings, anxiety and fear, guilt, shame, and self-blame. Those happen quite often. And sometimes you begin to see people withdrawing. They withdraw from other people, they withdraw from society, they just stay on their own, they want to be on their own. Then there's feelings of sadness and hopelessness. People tend to feel disconnected and they begin to feel numb as a result of this experience that they found quite overwhelming, this deep pain that they found quite overwhelming. All right. Some of your physical symptoms that you can experience as a result of trauma, insomnia, inability to sleep. So it can present an inability to initiate sleep, that is to start sleep, or inability to sustain the sleep. So you're unable to keep sleep for quite a long time. And then you wake up feeling exhausted, you wake up feeling tired, and you're not able to carry on with the activities of the day. So fatigue tends to set in. Being easily startled. Most times it happens a lot of the times with people who experience traumatic events. Perhaps one of the biggest examples would be people who are in conflict areas, people who have been attacked in a place of violence. They can get easily startled, and they're hyper-vigilant, and they're very conscious about their environment. They're constantly watching out to make sure that they're safe, and the people around them are also safe. Difficulty concentrating because your thoughts and your mind are going faster than you can control, and your mind is everywhere. Racing heartbeats, it happens quite often. You can have those racing thoughts, racing heartbeats, especially when you have a trigger or you feel like you have a perceived threat. Racing heartbeats tends to occur. Edginess and agitation, we also see that happen with a lot of trauma patients. Aches and pains. Because of how your body responds to trauma, and I think one of the things that we fail to understand is also how the body responds to trauma, that you tend to either become very stiff or you tend to become very rigid and uptight, and your muscles are always in a very tense state. And sometimes you can have aches and pains as a result of it. That we don't consciously pay attention to it, and we begin to see these things manifest, that the way our thought processes work, the way we process the things in our mind, begin to affect the way we physically act or the way we physically feel. We also have muscle tensions, like I mentioned earlier. It's very common with people who have experienced trauma. And that's because of the way the body also stays. The body sometimes stays in a permanent attack or flight position, and which is not natural. These responses come in when there's a threat. So when there's a threat, we run or we fight. So can you imagine your body being in a constant run or flight in the absence of an actual trigger or an actual threat? Rather, your body is in this constant position as a result of a memory or as a result of an experience. You can have a lot of wear and tear on the body. You can have a lot of wear and tear on the mind. So it's very important that we also understand that when you've been through an experience that you're finding it very difficult to shake and you're having these physical responses to it, that we begin to look a little bit more into it. I also want to mention that the fact that I've listed some of these things doesn't mean I have listed all the symptoms. These are one of the most common symptoms that we find. There are other symptoms that you can also experience as a result of it. And we like to always encourage doing some research, reading up on some of these concepts, or speaking to a mental health professional to also help you understand. All right, let's move ahead. So, as a result of traumatic experiences, as a result of psychological trauma that we can go through, we sometimes can experience mental health problems as a result. Some of the very common mental health problems that we see as a result of psychological trauma, emotional trauma, is anxiety. And, anxiety basically is excessively worrying. If I have to put it simply, it's a state where you are constantly worrying about everything. There's a constant state of fear. We all go through some form of anxiety. Anxiety is it's a normal response. It's actually very normal. We all have those processes. Let's say somebody has to speak. The person may be feeling anxious. You have to meet a new friend. You're getting a new job. You're relocating. In some cases, you're going to be a single mom. It can be quite nerve-wracking because we don't know what the future holds. We can be very apprehensive. However, when we come to a point where you develop quite a severe anxiety that is so debilitating that you can't even cope, you can't do anything, you can't move forward because you're worried, because you're worried or you're afraid of something, that's where anxiety can be very detrimental to your health. Depression, that's another mental health challenge that we could develop as a result of psychological or emotional trauma. So I know we tend to use depression, the word loosely, as, oh, I'm sad, oh, I'm depressed. Sometimes we can feel depressed, sometimes we can be sad. But depression, again, just like anxiety, is a deeper level of sadness. It's actually a mood disorder. It has a lot to do with the way you feel. Your feeling is concerned, and it's a feeling of sadness, a feeling of deep sadness to a point that you can't interact with people. You can't get up and do the things that you enjoy to do. Nothing brings pleasure to you anymore, to a point where you feel very hopeless, to a point where you feel like you can't see the future. There's no hope for you for the future. And it's quite a debilitating sickness that tends to be very common among people. We see that also among women. And when you experience a traumatic experience, when you go through a traumatic experience, depression tends to set in. It can easily set in if we don't watch out for the signs, and if we don't take care of ourselves, or if we don't get the right support that we need at that point. Post-traumatic stress disorder, PTSD, it's also one of the common mental health challenges that we can develop as a result of psychological trauma, emotional trauma, and any other form of trauma. Post-traumatic stress disorder can come as a result of it. Okay, psychosomatic disorders. Most people can develop psychosomatic disorders where you begin to have physical pain in the absence of any actual response or any actual reason. With psychosomatic disorders, it can be a little bit tricky because you would need the intervention of a doctor. You would need to have a medical clearance to say, okay, I'm constantly feeling this pain. I'm constantly feeling this. I have this feeling in this part of my body. So you'd need to go to the hospital to ensure that there is no physical reason for that. So in the absence of any physical reason, and you constantly feel a certain pain or a certain movement or something on your body, most times it could be psychosomatic, and it will encourage you to see a psychologist to have this talked about. Psychosis. Psychosis is an umbrella term for a group of mental health challenges that revolves around losing touch with reality. There's delusions, there's hallucinations under psychosis. So it covers a lot of mental health challenges, like schizophrenia is an example of psychosis. They have delusional disorders, there's schizotypal disorders, that they all fall under psychosis. We have sleep disorders. A lot of the times people can develop sleep disorders as a result of a traumatic experience. Like I mentioned earlier, sleep is one of the things that would be affected most times once people experience some form of trauma. As we talk about healing, as we talk about going through the process of learning how to heal, it's very important for us to understand that no two people are going to follow the same process. What works for me may not work for you. What works for me could take you to a particular point, and then that's it. And then what works for the other person can take them to the end, and they are good to go. You know, the healing process is not linear at all. You can have your ups and you can have your downs. The most important thing for you is to learn to be kind to yourself and to walk that journey. As with the right support, you'll find that your healing process goes through some form of transition, some movement where you have progress. At the end of the day, we want to see the small progresses, the small changes. Sometimes we come into therapy, we come into a place of support thinking, once I talk to this person, my life is better, everything is going to go. The first conversation, it doesn't always go that way. You have to visit those memories that were disturbing for you. You're going to have to walk through that journey of trying to unpack and understand what happened, and then learn to take back control and learn to lead a healthier life. So let's look at some of the things that you can do to deal with emotional trauma. So get moving, get moving. We've talked about some of the things that trauma can do to you. It can actually affect your physical body and keep you in a state of flight or fight, keep you in a very rigid state. Get moving. Exercise, whatever exercise is for you, whatever is recommended for you, just get up and move. get up and move, release your body. Exercise and movement can actually help your nervous system. And that's one of the things that's also impacted when you experience a traumatic, when you have a traumatic experience. Just get moving, whatever it is that works for you. I like to always encourage my clients, just come out and walk in your compound, whatever it is, in your room, in your parlor. Just do like a 10 minutes back and forth, whatever works for you, or go just walk around your compound. If you are opportune to go down the street, just come out of the gate and walk down the street. Sometimes you can walk in the company of people that you trust. You can walk alone, just do something. And then if you want to go to the gym, that's also okay. You can start to go to the gym to also get yourself moving. Don't isolate. It can come very easy for you to think you need to isolate because you feel like that's the only place that you have some level of control, or that's the only place you will feel safe. Don't isolate. Connect with people, especially people that you trust. Sometimes one of the fear is that when we start to talk with people, they can start asking us questions. Oh, what happened? What, you know? And you don't actually have to talk about it, but you have to connect with people that you trust, people that you feel safe with. Part of having those people in your life is that they begin to also make you have some sense of normalcy, some sense of that life is also, there's some good in life. And you talk about other things out of what has caused the trauma. And then when you feel comfortable with your safe people, you can have the conversation if you want. Ask for help. Ask for help. It goes a long way, especially when people are depressed, and you have that state where you feel the need to be isolated and you feel the need to be withdrawn. Ask for help. You know, it goes a long way. Seek for help. You as the person who is experiencing that feeling, reach out. I like to use that word, just reach out. And for family members who they see people that are going through a hard time, it's also for you to reach out to those people who are going through that hard time so that you're able to offer the right support to them. Reconnect with your loved ones. It's also time for us to keep in touch with our loved ones as a way of engaging. Engage in social activities. There's lots of social activities that we like to engage in and that can keep us in a good mental health and a good mental state. Please do those things as a way of connecting with people. As much as you can, if possible, where possible, join a support group. One of the things that mental health challenges or traumatic experiences or negative experiences can do to us is that they make us feel like we are alone. We are the only ones experiencing it, and there's nobody else in the world that can understand where we're coming from. But you'll be surprised what happens when you meet people who go through the same journey. You'll be surprised what happens when you begin to talk to people and you see that we are all going through the same journey. Maybe we are all going through some experiences. Maybe they come out in different ways. But at the end of the day, connection is very important, and it's good for you to build that bond with people and to just have another form of normalcy in your life. Self-regulate your nervous system. Self-regulation is very important. Mindfulness, it goes a long way. Either mindfulness breathing, yoga, any meditation, those would fall under mindfulness activities. Soothing activities, what are the things that make you happy? Look for those things that you used to find joy in, or the things you want to do. They can be leisure activities and that you can adopt that can make you learn to self-regulate, learn to calm yourself down. That's what it's about. What are those things I can do to breathe, to calm down? It could be listening to music. It could be reading a book. It could be chatting to a friend. It could be doing something. It could be maybe petting a dog or cleaning or anything it is that makes sense to you, that calms you down. Allow yourself to feel your feelings. That's one thing I like to tell people. It's so easy for us to run away from uncomfortable feeling because it's uncomfortable. Acknowledge it. Allow yourself to go through it. And and in your process of healing, yourself will be okay. You'll be fine. But this is what I'm feeling now, and it feels really uncomfortable, but I will be okay. So physical health is another thing that we need to pay attention to. Sleep hygiene. Remember I said the sleep gets disrupted as a result of a traumatic experience. Engage in a healthy sleeping hygiene. Engage in a healthy sleeping pattern. It does really well for your body. Also, so that when you wake up in the morning, you avoid any other health challenges that you could experience. Say no to alcohol and drug as a way of coping. It can be easy for us to pick up that bottle, pop that pill, try as much as possible to avoid it. If you must take medication, it's important that you take it with a practitioner, a doctor, and make sure that you are getting the right support that you need going forward. Reduce your stress and seek medical help for your medical checkups. So if you have done all these things that have been listed and you feel like you need support, sometimes we find that we have trouble functioning at home, at work, and we're suffering from severe fear, anxiety, and depression. We're unable to form close relationships and satisfying relationships, and we experiencing terrors, nightmare, flashbacks. You find that we keep on avoiding things and people that remind us of the trauma. We're emotionally numb. We're using alcohol and drugs to feel better. If you get to that point, it's very important for you to know that that's the point where you seek the mental health support that you need. That's the point where you have to go to the doctor. If months have passed and your symptoms haven't resolved, walking through your trauma can be scary and re-traumatizing, and that's the truth. Choose a therapist who is experienced and who you feel comfortable with. It's very important that you actually look for somebody who you feel comfortable with, because that also makes the healing process easier and better for you. I'd love for us to do a breathing exercise. I like to always end with a breathing exercise, but because we're out of time, I'd like for us to take in our own personal time to try the 4-7-8 breathing. It's a form of relaxation exercise that just helps you. You can do it at any point in your life, wherever you are, in the classroom. Please don't do it while you're driving, but you can do it and when you are seated and when you are in a still position. So just take that time and just go and read up on breathing exercises that can help you. You don't even have to be traumatized to know how to do this, but it's a tool that helps you in your everyday life with breathing and relaxation and calming down yourself. So I'd like to say thank you. Thank you for this opportunity. And that's it from me.
Thank you very much.
Thank you.
Thank you. Awesome. Thank you so much, Chiyenreugo. As a psychologist, I know how much you've tried to squeeze into this.
Yeah.
Thank you for that.